Many shades of pink and black health. Many shades of pink and black health, where good health equals long life.
Welcome to the Many Shades of Pink and Black Health Radio program on KBOKradio.com, sponsored by Many Shades of Pink. I'm your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo, a retired family physician. And today our special guest is Ms. Shakita Jones, a lupus warrior. Our topic today is becoming a warrior and advocate for lupus awareness. So, Ms. Shakita, welcome today.
Yes, welcome.
Thank you for having me.
And we're glad to have you here today. And we're just going to dive right on in and ask you all these good questions. I don't know you personally, but I heard a whole lot about you from my dear sis here. And so just tell us about yourself and your family.
Okay. Well, I have 3 children, 23-year-old daughter, 17-year-old son, and a 13-year-old son, and a 2-year-old grandson.
Oh.
Yes.
So your grandma.
Yes.
All right.
I look like mom, so it's a good thing.
So where were you born and raised? Where did you go to school?
Well, I was born in St. Louis, Missouri,
Okay.
and I came out to San Diego when I was 9 years old, so I've been out here for 32 years. I went to school, Claremont Madison High School.
Mhm.
I've gone to school around here, Horton Elementary School. And I grew up in Southeast San Diego,
Okay.
over by 35th and National City, that area, Imperial Avenue. So Southeast has been my home these 32 years.
Okay. Perfect.
So you're a Midwest woman, huh?
Cali girl with a hint of Midwest.
Okay, so because you've been out here since you was 9. I'm from the Midwest too. I'm from Ohio.
Yeah, people can hear the little accent from St. Louis, Missouri, but when I go home, they're like, "Where are you from?"
Yeah, you know that you guys do have a very, very recognizable, accent. Because I'm trying to think of the accent that this one word that my girlfriend would use. She was from St. Louis
Over there.
Yeah.
My best friend called me on the other time. She said, "Say it one more time. Say what?" Or I'll say like pickle. Yellow.
That is different.
It's very different, and it stands out.
Yeah. So now that we know just a little bit about yourself and your children, since this program is actually about lupus, tell us a little bit about your health before you were diagnosed with lupus.
Well, before I was diagnosed with lupus, I was a very active mom with my children. They were in all kind of sports. I believe in children not being at home during the summertime, but being active. And I volunteered a lot at my son's school. And I was in college. I was 2 semesters away from graduating from college. And it was a very great time in my life. I was really enjoying watching my kids grow up and being an active role in their lives. I have my home and my pets, and that was my life, and I was really happy.
Okay, what age were you diagnosed with lupus?
I was diagnosed with lupus at 38 years old.
Okay, yeah.
And how many years do you think you were having symptoms before you actually got the diagnosis of lupus?
I believe I was having the symptoms right after I had my first child at 18.
Okay.
That's when the fatigue started setting in.
Okay. And why don't you let the audience know some of the other symptoms that you were experiencing, not knowing what you actually had at the time?
But before that, can you explain to our audience that may not know what is lupus?
Okay. Well, lupus is a chronic autoimmune disease. It causes inflammation of the tissues and the organs. Our bodies are created to fight off things such as viruses and bacteria, things like that. So our body makes antibodies to fight off these germs and bacteria and viruses. But when you have lupus, your body turns on you and start attacking you and it sees you as the enemy.
Mm-hmm.
And it's a real hard disease to diagnose because it mimics other diseases. It mimics things like the flu, heart disease. Doctors might think you have diabetes, or you're just depressed, or you're having severe anxiety. Especially for women, they're usually diagnosed with having depression before they're diagnosed with having lupus, because that's just a sign to women in our society.
Mm-hmm.
When you complain about being tired, and not tired but extremely fatigued.
Right. Okay. And what other symptoms, do you experience, just besides being fatigued? Is there something that, like, if one of our audience experience fatigue, but is there something else that can make one of our audience that's listening or watching, something that can be, point, straight point, leading them to say, hey, well, let me ask them to, test me for lupus.
Okay, some other symptoms are joint pain, joint swelling, fatigue again, rashes, fever, high fevers, and overall body aches that are unexplainable, memory loss, things of that sort. And when I say fatigue, it's fatigue to the point of where you can't even get out of bed. Like for me, for example, I was starting to pass out. I couldn't even walk from my bedroom to the bathroom without fainting. So it can be symptoms like when you sit down or when you get up, you just feel so dizzy that you're going to pass out.
So, sis, with all those symptoms that she's saying, it sounds like it could be so many different other things. So how do the doctors kind of go about diagnosing lupus?
Well, it's actually a process because we have to rule out other conditions.
Mm-hmm.
So you do a full examination, you do a full panel of blood tests and urine and things like that to rule out things like just anemia, or any other kind of chronic disease, diabetes, high blood pressure if you're having dizziness, things like that. So you want to make sure their vital signs, which are their blood pressure, their blood sugar, their heart rate, things like that are fine. But then you have to do a process of elimination. So you have what we have as a differential diagnosis, a list of possible diagnoses. And as you start getting tests that rules that out, if her sugar is normal, diabetes is not an issue. If there's something else, if you do a kidney test and that's normal, then it's not kidney disease causing it. So then you rule it out, and then you can they have some antibody type tests and an SLE, LE type test that they can do specifically, but that's after they've ruled out all the other things. They don't just go straight to lupus and try to evaluate that. It's a process of elimination.
And that's hopefully if you have a doctor who are willing to do all those extra blood works, because my doctors didn't even start listening to me until my skin broke out with all these blotches on my skin.
Mm-hmm. So, because everything that she said, that all her symptoms, I have that on the regular.
Exactly.
And so, that would be, is there a certain type of test for lupus?
There is something that can help them identify that it is lupus after they've ruled out everything. Like I said, when they come in and they're complaining of those symptoms, they're not going to use the lupus test as the first test. Okay. So they're going to rule out everything else, and when they can't, when it's down to one or two diagnoses, it's a possibility of lupus, then they'll go ahead and order those types of specific testing.
I believe it's called a panel test.
Mm-hmm.
Yeah,
a panel test. And so when you say you have blotches on your skin, where were you getting those blotches at? Is there any certain areas of your body, or was it just all over your body?
The blotches came all over my face, my shoulders, my arms. It stopped at just beneath my breast. I got a couple on my thighs and my legs. And initially, I thought that the blotches were just like indents from the sun, from my glasses on my nose.
Mm-hmm.
The summer of 2011. And it didn't go away. Well, actually, I had a mark on my nose, and it didn't go away. The following summer was when my skin broke out. Looked like I just had like a rash, little tiny dots, but they were like a rash. And what really happened was I became allergic to the sun. So the sun was causing damage to my skin, and I didn't know. I thought, and I would ask my family, does the sun feel hotter to you? And they would tell me no, but it felt like a magnifying glass for me.
Like it was just burning you.
Yeah, and that's what it did. It burnt my skin.
So the typical rash for a typical lupus patient is what they call the butterfly rash. So it tends to be a redness, and for African Americans it would be a darkness, so maybe a brown if it's not red, across the nose and into the cheeks. So it almost looks like a little butterfly. That's a typical rash, but not everyone gets that rash. That's certainly going to be possibly involved in what they call systemic lupus erythematosus, so that's SLE. But there's a discoid, there's 4 types, and we could go into the 4 types, but there's a discoid where it sounds like you might have been presenting that way with all these round disc-like rashes all over your body.
Right.
That may not come up with a typical traditional lupus patient, where it's mostly just a facial rash.
Right.
So that could have been confusing. I think you mentioned that that's what the doctor thought you had initially.
Right, they thought I had discoid or subcutaneous lupus, which, like you said, discoid leaves scars on your body, and subcutaneous, there are these patches all over you. And from my research, I knew that I didn't have discoid lupus, and I really fought hard to get a doctor to listen to me to take the blood panel. It wasn't until I ended up in the emergency room that they decided to take the blood panel for me, to tell me that I had SLE, not discoid.
So how long did you had to endure and convince the doctors, to give you that blood panel?
About 2 years.
Wow.
2 years. And it took them over 2 years. The first year they didn't know what was wrong with me. They kept giving me the wrong diagnosis, the wrong medication. The second year, after telling them and begging them, I don't have discoid lupus, a doctor, I threw the race card on them. I did.
Well, it's not a race card, it's actual fact.
Yeah, it is.
It really is. So, they probably would have given someone other than the woman of color that panel right off, and they wouldn't have to fight for 2 years. And I just think that it's a shame that you had to wait for 2 years to get something that should have been offered to you after everything else.
Right, the average person has to wait between 4 to 7 years before they even get a diagnosis of lupus.
That is amazing. I'm not shocked, sis. We're not shocked.
I'm not shocked. I'm in the system. I understand.
Yeah.
But I do want to let the audience know that the reason why Shakita probably knows that it wasn't discoid after doing her research is the discoid or cutaneous lupus really just affects the skin, and you don't have all these other attacks on your organs. So all the other symptoms she was feeling, your typical discoid lupus patient would not have that. It's really a skin condition.
Okay.
And when she was having all the fatigue and the various other symptoms, that the joint aches and things like that, she knew was more than that.
Okay.
And that's why she had to continue to push for someone to let her know, truly what is going on.
Yeah. Okay, so that
and that comes with pain too. A doctor will say you don't have pain associated with discoid, but you have the physical pain of your skin changing, and people looking at you. But it also causes body aches and things like that.
Yeah, but I'm still kind of pissed that you didn't get your diagnosis until 2 years afterwards, when it's just like, if you would just took a simple, give me the test. Give me that test so I can know what's going on with me, because that right there, it gives you stress, anxiety, and everything else. They're them actually misdiagnosing you. So
I do have a question about the people that were doing the workup in those 2 years. Was that strictly just your primary care provider, or were you already referred to a rheumatologist that specialized in these autoimmune diseases?
When I first got diagnosed, I saw a doctor who, God bless me to find this doctor. One night I left the ER because I was tired of them saying that there was nothing wrong. So I found a doctor who has studied under a rheumatologist, and she noticed some symptoms. and she sent me to a dermatologist. They took a biopsy, and then they told me I had lupus, but he also said he didn't know what kind of lupus I had, so it was like a double whammy. So then I went under a rheumatologist, and those are the doctors who primarily take care of you, is a rheumatologist.
Yeah, I think what we'll do is we'll stop there, take a small break, and come right back and pick up there.
Okay.
So you've been listening to the Many Shades of Pink and Black Health radio program on KBLKradio.com, and we'll be right back after this break.
Welcome back to the Many Shades of Pink and Black Health radio program on KBLKradio.com, sponsored by Many Shades of Pink. I'm your host, Wendy Sherrill, breast cancer survivor and advocate.
And I'm your co-host, Dr. Susanna Flalo, a retired physician. Today our guest is Ms. Shakita Jones, a lupus warrior. Our topic today is becoming a warrior and advocate for lupus awareness. So welcome back. And Ms. Shakita, you were in the middle of explaining, finding that special doctors that happened to identify some things, had you go to the dermatologist, get a biopsy, then you got the diagnosis of lupus, and then you referred to a rheumatologist. Pick us up from there.
But I have a question. When you say a biopsy, what did they biopsy?
They biopsied my skin. They cut a little piece of my skin off of my shoulder, and they did a biopsy that way.
So one of the patches of the rashes that she was complaining about,
Right.
why she went to the dermatologist.
Okay.
At the first point, people were misdiagnosing her, calling it discoid lupus or whatever, but she had all these patches of rash all over her body. So this doctor that identified it referred her to the dermatologist. Then she got a biopsy, a sample of that, one of those patches of rash, and that's what came back showing an inflammatory process or lupus.
Okay. All right.
Yeah.
So you're teaching me something. I'm learning. Thank you.
As so is our audience. And so with that diagnosis from the dermatologist results, were you then referred to a rheumatologist?
Yes, I was referred to a rheumatologist, and even though my doctor suspected that I had lupus, she couldn't give me the medicine that lupus warriors use until I got a diagnosis of having lupus. So my skin had to continue to get damaged. That was months after. It took my insurance over 3 months for me to see the dermatologist.
You mean
Right.
the rheumatologist or the dermatologist?
The dermatologist.
And then
So-
how long
and another
after?
3 months to see the rheumatologist.
So that long delay is a health care
Right.
or insurance process.
Right.
Okay, because in other organizations it doesn't take that long. It really doesn't. Like at Kaiser, you
Well,
can
it-
see a
but it should-
dermatologist next week and a rheumatologist within a couple
I
weeks.
know, but it shouldn't took her that long.
I
either.
understand that, but every insurance is not equal. Every health insurance is not equal, I promise
I
you.
know,
Yeah.
know. But I'm just saying that process, someone getting a diagnosis and have to wait that long to, so while she's waiting to see the doctor, her disease is
Getting worse.
getting, it's getting worse. And not only that, but what it's doing to you emotionally and mentally.
And it was causing other symptoms, like I couldn't breathe, I got a staph infection, lupus laid me out on the floor. It's like the worst case of the flu, on top of getting hit by a bus over and over again.
Wow. And lupus is something that I noticed that a lot of our African American women do get.
It's more common
It's
in
more
African
common,
American women.
right?
Mhm.
And we're the least who know about it.
Right.
That's why you're doing what you're
That's
doing.
exactly why
Yeah.
I'm doing what
So
I'm
we'll
doing.
get into that in
Yeah.
a little bit. You mentioned something about your symptoms getting worse with each pregnancy. Can you explain that a little bit?
With the first pregnancy, I developed being very fatigued. The second pregnancy, I developed a lot of unexplained body pain. I would try to go to the doctor and explain to him that I'm having these pains. I didn't have the right vocabulary to explain how I was feeling. The third pregnancy, I was on bed rest for a majority of it, and I will have severe stomach pain and fatigue. and they just associated that with pregnancy. Each time it was because you was pregnant. Now, granted, my first pregnancy was when I was at 18. The second was 25, and my last child was at 30. So in between those times, I kept going to the doctor saying that something's wrong, to the point where I thought maybe I was crazy or something, like maybe I'm making all this up in my head. And that's the case when I speak to many lupus warriors, they feel the same way.
Okay,
Because
yeah.
it's an invisible disease for most people.
Right. It's like it's like a silent disease, huh?
That's why they diagnose a lot of women with being depressed.
Right.
So, since you were diagnosed at the age of 38, you suffered with symptoms for 20 years.
Yes.
Yeah, I did.
Yeah.
Yeah.
20
I did.
years.
And the last, at 38 was when it just, everything just
Took
it
its toll.
took its toll. It laid me out, literally. It just knocked me off of my feet.
Were you able to work or go to school during this time? All those years?
I was able to go to school, but when I would go to school, I would always feel really tired and drained. I couldn't, and I didn't understand, like when I would go to like IKEA, I would just immediately feel very drained. You know, my body would ache, and like I said, I couldn't concentrate. And whenever I went to a doctor, they would just say, take iron pills. That would help you, you know. But what I didn't understand is that the fluorescent lights make me extremely tired. The sun make me extremely tired. Stressful situations make me extremely tired and sick.
So that was like one of the symptoms that was ongoing. So do you have a family history of lupus?
Yes, I have an aunt who died from lupus. I later found out after I was diagnosed with lupus that she died from lupus. I always thought she died from a kidney disease. So whenever I would see someone whose skin was really dark and they looked like they was carrying like a lot of water in their skin, I just associated that with them having a kidney disease.
Me too.
I didn't know that it can also be lupus.
Right.
And then I have a cousin that I've never met, just on Facebook. He has lupus, and I believe a female cousin who has lupus also.
Oh, wow. Interesting.
So I don't think the audience knows that the average age for people to start getting symptoms are between like 14 to 44.
Wow.
So it can start
that's
as
really
early as
young.
that. Yeah.
Huh.
And it is more common in women, but men, children, and some other people can get it, but it's more common in women, and African American women are like, I think, 3 times more likely to get it than the Caucasian.
Yeah.
So it's predominantly a disease that African American women suffer with, and unfortunately we tend not to be knowledgeable about it.
Right.
And so we can go on thinking that we're just tired and we're just anemic and whatever, but we need to push forward saying, well, you know what, I'm taking the iron tablets and I'm still not feeling any better. My numbers are fine now, but why am I still feeling so fatigued? And then anemia tends not to cause you all the other symptoms. You can feel tired, you might even have a little achiness, but not to the degree and the severity of lupus when you get, one of your severe crises where your joints are so achy, your muscles are so achy.
Your bones, everything hurt.
I mean, that sounds like sickle cell too.
Yeah.
Well, that's what she mentioned, invisible diseases, and there's about 3 that I can think of offhand, but I'm sure there's many more, that when the patients present, they look fine, but you can't measure their pain, and it's especially with African American women. I know this, that or women in general, but lupus, sickle cell, of course, which men can get, but fibromyalgia.
Yes.
And there's achy body, the foggy brain, the confusion, everything, the depression, the anxiety, all that put together, bowel issues, so many different symptoms, and that's a diagnosis of exclusion. There is no test that says you have fibromyalgia. You have to rule out everything else, including lupus, to then be diagnosed with fibromyalgia, which is just as horrible, just as painful can be, and it's something that people do not get treated, for appropriately.
And fibromyalgia is just now getting recognized in
Yes.
the medical world. When you have lupus, sometimes it comes with other autoimmune diseases. Like mine came with Sjogren's, and that's an autoimmune disease that dries all your glands. I have fibromyalgia and Raynaud's and anemia. So it came, I call it, it's sisters, brothers, stepsisters and brothers.
Yeah.
So it comes with other things.
Yeah. Now, I worked with a young lady that was diagnosed with lupus, and she was always fatigued, and but she took up yoga as one of the things to actually help her. It didn't take a lot of her symptoms away, but it did help her in the process.
Yeah, exercising helps a lot. I just recently started back exercising because I just recently got my iron infusion, and
tell our audience what an iron infusion is.
well, by the end of the year, I'm depleted of iron. We need that for energy for our bodies. Without it, I'm just very sluggish, and I can't think. My thoughts are all over the place. But once I get my iron infusion, so basically what happens is I go to an infusion center, and they use an IV, and they put iron into my system. I have to get it done twice, and there's a different kind of iron, so it has to be the right one that works for me. There was an incident where the doctor gave me the wrong one because my insurance didn't work, and I went out in the sun for 10 seconds, and I got severe joint pain. My joints started swelling up, and that was the first time that my joints started swelling up. I've never experienced like joint pains like in my wrist, but it's just an achy feeling. So anyhow, I was hospitalized, but ever since when I have to get those iron infusions once a year, that's how much my body uses up. It just absorbs all the iron that I have in my body naturally.
Well, what's the two different types of iron infusions?
There isn't two different types. There's different medications, like different names.
A different brand?
Different brands of iron.
Okay.
Iron and,
Sis, can you tell me a little bit? Can you tell me?
I don't know about two different types because I just know iron infusion. Yeah. But unless there's some particular brand that she doesn't seem to tolerate.
Right.
But, you know.
Yeah.
Oh, okay.
Yeah,
because you can have, they have different types of, you have the generic kind and you have
it's a generic kind,
right.
And that kind didn't work for me. But the insurance always try to give you the least expensive medication before they give you the actual medicine that works for you.
Right. Because sometimes the generic will have a side effect that the regular one won't. But then there's generics that work perfectly fine.
Right.
To be honest with you, the generics are the same ingredients. The problem is when they're compounding them, say, into a tablet, they might compound it with something like the color of a pill or something. That can be what causes the reaction. But the actual ingredients is supposed to be the same.
Right.
So, some people may have an intolerance to it only because of how it's compounded.
Okay.
But it should work effectively. I've had patients come in and say, I want the generic, that's the only thing that works for me. It makes it hard because it's, $1 pill versus $10 pill.
Yeah.
And it's hard to justify giving a $10 pill medication when you know the $1 pill is the exact same. But some people, and I've had patients do it, some people, before they even try it, they just want the name brand. So they come in with an expectation without even trying it first.
Right. So,
and there has been patients that did not tolerate or did not respond as well to the generic, then we go ahead to the brand name. But if we were to do brand name for every single thing, the medications would not be cost effective. So we have to keep it at a point where we can keep the costs down. But when you have a patent on a prescription, that's the only thing out there. So once the patent is gone, 10 years, 20 years, whatever it is, then every other company can compete. So there's not a monopoly. So that pill is no longer $10 a prescription or a pill. It can be 50 cents.
Right.
And then that's where things go. So, understand that. But, you mentioned about the iron. So does that mean you're taking oral iron throughout the year? And then, I'm a little confused as to why you only need the iron infusion once a year.
Well, I can't tolerate the pills.
Yes.
And it won't stir in my body. So what I do is I'll eat foods that have iron in it.
Okay.
They tried blood infusions on me before too. That didn't work.
What about liquid iron?
Yeah, because since you told me about the liquid iron.
Sometimes people tolerate that better than the tablets. So
Because I don't like that. I can't
that?
tolerate the tablet myself.
I decided not to take the liquid because, see, when you take medicine, it causes issues in other areas. So, to the best of my ability, I try to eat foods and like smoothies with things that will help my iron deficiency.
But that's, you know, I'm just speaking for myself. I find that when I try to do it that way, it takes me forever to get my iron.
Oh,
My iron up. You know?
So I'm curious, why do they only allow you to get it once a year, or you do only need it once a year?
Only need it once a year. Actually, they usually every other summer, the following summer.
Okay.
Yeah.
Okay. So give us an idea of the other medications that you've had to use to keep your lupus symptoms under control, because there is no cure for it.
Right.
Yeah.
I've had to use chemotherapy, injections that I would do at home myself or a family member would do for me. I've had to use steroids, which keeps inflammation down, but then it'll cause other issues like pie face, and some people gain weight. For me, I couldn't gain weight because I never had appetite. The medication, I use an anti-malaria medicine called hydroxychloroquine or Plaquenil. That's the brand name. And that's an anti-malaria medicine actually. And I use Primadone. That's for people who have seizures or tremors. And nortriptyline, which is an antidepressant, but it also helps with nerve pain. I take Xanax to help me to sleep, and I take Adderall to help me to focus, like during the week. But on the weekends, I don't take it because I don't want to be stimulated over the weekend. I want to be able to give my body opportunity to rest.
And you want to have, I always say I need some clarification. Because sometimes you just feel like you're just out of it, you know. You're just not yourself. You're kind of spaced out a little bit. You're you know, kind of just spacey.
Yeah.
You know.
Over the weekend is, I always have to remind myself that all the things that I do, it'll catch up with me over the weekend.
Right.
You know, and then I'm laid out on the bed, and I have to give myself permission to rest. God rested. You need to rest too, Shakita.
Yeah, Shakita.
Well, you have to. I mean, you know, if you without that rest, you know, I have to take my own advice.
So, how often do you see your rheumatologist, and what types of tests do they do regularly to keep, you know, an eye on your organs that might be affected by your lupus?
I see my rheumatologist every 3 months. They make sure that my iron is okay. They check my white blood count, my red blood count. They make sure that my liver is alleviating the medications properly. My kidneys are getting rid of the waste properly. They check my heart to make sure that it's pumping properly. I get my eyes checked a lot. Maybe 6 months or every year, because the medicine hydroxychloroquine can affect your eyesight, make you go blind. So they have to check you at least once or twice a year. And
So you are on a lot of medications, and you have to visit your rheumatologist every 3 months.
Initially, I was on like 16 medications. Now I'm down to six or 7 medications.
Wow, I don't think that. I just eliminated a whole lot of them. I'm like that too. I don't like to take a lot of medications, but I know that it's necessary. You know, the ones that's necessary I do take, but the ones I feel like they're not necessary, I don't take. And I know, sis, you're not.
I'm not in agreement.
Not in agreement with
I
that.
feel like you take what's necessary to help control the symptoms that are troubling your life.
Yeah.
So in order to have the best quality of life that you can with the conditions that you have, take what you feel is necessary. Because every single one of the medications have some toxicity to them. It's what you can tolerate, and it's what what the trade-off is. So if you taking it has some side effects but gives you a better quality of life, then choose to take it. But if the side effects are worse than the actual symptoms you have, then I would say disregard it. That's just my opinion.
Yeah, that's what I actually kind of done.
Yeah.
Yeah.
Yeah. So, you know, you developed this advocacy platform. What sparked you to do that?
What sparked me to do that was a conversation that I had with my aunt at 17 years old. She felt very lonely in this disease. She would go to dialysis, I think once or twice a week. She would be there alone. You know, family member would drop her off, but no one sat with her. And also, when I was diagnosed with lupus, I was alone by myself. You know, I didn't have any support. And I don't want anyone else to not have support or be aware of having lupus.
So, do you guys have like a support group where you meet on a regular basis? And if so, like, where, you know, do you have the name of it? Just because I do know a few of lupus people, and they always do complain. No lupus support groups.
Right. That's another reason also. There was no support groups in Southeast San Diego, so I started my own. Currently, I'm doing presentations, so I go to different organizations to present lupus and bring awareness to people. It's just me.
Mm-hmm.
I'm a woman on a mission, and but they can find me on several social media outlets.
Okay.
Tell us the name of your support group or your
Yes.
organization.
Your
actually.
organization, yeah.
It's called Lupus Warriors United 2016 on Facebook.
Okay, well, I'm gonna have to request you as my friend so we can get, we can help each other. I'm all about women, helping other women and getting your message out there, because lupus is right up there and with cancer,
Right.
and we have a lot of women that have lack of support, especially African American women, and lupus falls like right there with not having that support. That's the same thing with not having a support group here in Southeast for breast cancer.
Right.
So I think that is very, very important that we all come together and help one another, get the word out, and try to support as many women that we possibly can.
Yeah, I would love for people to contact me. I've tried starting a support group, and it's just a matter of finding people to come and getting my organization out there and making people aware that I'm a resource in our community.
Yes.
So, but in the meantime, in between time, I've been doing presentations also and networking that way, with the ultimate goal is to bring people on board to help me spread lupus awareness.
Can you give our audience your website name on how to contact you, and also give them your phone number on how to reach you?
Okay, so on Twitter, I'm at Kiki4, like the number 4, Cure Lupus. And on LinkedIn is LinkedIn, www.linkedin.com/IN/Jones14B374105. And they can also reach me by email at Shakita Shanta Jones, SHAKITASHON as in Nancy, TA Jones @gmail.com. And lastly, Facebook, Lupus Warriors United 2016.
Okay. So those are all the different social media groups that you're on.
Right.
Okay. Well, I will make sure that I will request you so that we can, network together. I have a passion for breast cancer, and And when I started out, I mean, I didn't know this is what's my purpose. Didn't know, but when I always tell sis that God puts you where He wants you to be. So you're where He wants you to be, and that is basically bringing awareness and education to lupus.
Yeah, once I came into acceptance and surrendered it, it has made living with lupus manageable. I get a lot of joy spreading lupus awareness, and I told God I would give glory to His name and help other people with this disease.
Amen to that.
Yeah, that's awesome. Thank you for doing that, and I say God bless you because you're doing the same thing that we're doing, and that's just basically trying to help save lives.
Yeah.
And I'm just curious, we're going to take a little switch on the conversation because you and I spoke, and I know that you, as many other people of color, suffer discrimination and disrespect when you go to try to seek help. So now that you have this diagnosis, you're living with all of these horrible symptoms, especially severe pain and joint aches and things like that. When you go to seek help, what happens? How do you feel treated? How do they treat you?
Before I answer that, let me also say that I have a YouTube. You could find a documentary about me on YouTube. Also, type in lupus, and I think I will pop up. At the hospital, doctors. In fact, I wrote some notes about that. I wanted to bring attention to the discrimination by the doctors, especially in the ER. The denial of pain medications and the discriminatory comments that they make towards me because I'm someone. Okay, should I keep going? Okay. So whenever I go to the hospital, I'm basically, my back is against the wall because the medications that I take aren't for pain, aren't working. So immediately when I go to the ER and I feel discriminated against. They usually ask me a whole bunch of questions that's none of their business.
So when you say discriminated, to what degree are you discriminated to? Like,
I can give you guys a sample of a script. I'll go to the ER. They'll come in, Miss Jones, how can I help you? I'm here because I'm in a lot of pain. Well, how come you didn't take your medication at home? And I'll say, because that medication doesn't work for me. So why did you come here? We're not a pain management.
Wow. So sis, right off the bat, they think that you're seeking medication or
Drug
some drug seeking.
Right, and I have to explain, well, those medicines aren't helping. And, okay, well, how do you know if you didn't take them? Because I know my body. Okay, well, we don't manage pain here, and then I have to say, can I talk to someone over you? And then they come in, both of them come in at the same time, and they're very judgmental. Well, we'll give you pain medication, Vicodin. And then that's when I get insulted. I'm like, I have Vicodin at home. I'm not here to get high. If I wanted to get high, have all the pain medicine in my home, and there's been times where a doctor told me, well, your pain isn't worse than someone with a broken foot, so I'm not giving you those kind of medicines. You could take Vicodin. And then if I have a doctor who does give me morphine, which makes me itch, they don't want to give me the medication to prevent the itching, which is Benadryl, like in the IV, because they say, well, we don't want you to get high.